It is my privilege to introduce Gerald Antoch as the presenter of today's honorary lecture. Professor Antoch.
Well, thank you for the introduction, and thank you very much to the European Society of Radiology for inviting me to this prominent lecture. Hybrid imaging, radiology, and nuclear medicine, let the two worlds come together. Well, the first question we have is, what is a hybrid? Is a good imaging system all we need for conclusive diagnosis? Albert Einstein, he said, that's about 80 years ago, computers are incredibly fast, accurate, and stupid. Human beings are incredibly slow, inaccurate, and brilliant. Together, they are powerful beyond imagination. So you have to have both. You have to have the good imaging system, and you have to have the people to work that imaging system. CT is nothing more but anatomical correlation and attenuation correction of PET. This is from the nuclear medicine expert. And obviously, this expert tried to claim PET-CT for the nuclear medicine side. FDG is nothing more but the new contrast agent for CT. That's from the radiology side. And obviously, this radiologist tried to claim PET-CT for radiology. Well, when we go back in history again, and we have to go back a little further to the year 1896, there are very many examples where experts proved to be wrong eventually. And in 1896, there is a very good example of this, and in fact that fits very nicely into this Wilhelm Conrad Röntgen honorary lecture. It's a quote from Sir William Thomson, and it's on the discovery of the X-rays by Röntgen. And he said, X-rays will prove to be a hoax. Now, we know today that that was definitely wrong. This case has an anteriorly located lesion, and that was PSMA negative. And this was a patient with a raised PSA level. He had previous negative ultrasound-guided biopsies, and this is a typical location where the ultrasound-guided biopsies are falsely negative. So you can detect this tumor with your MRI component of the PET MRI, and if you want to, you can further on biopsy this tumor in bore in order to correctly reach this tumor with your biopsy needle. So how much morphology do you need? Well, you need as much morphology as you can get, and that's even more important, you need the expertise to read those images. That is extremely important. In order to get those specialists, we need new training concepts, and they have to integrate both disciplines. This is extremely important. And we have to hybridize both disciplines to one imaging department. And all of you here in the room can do your share to this goal if you want to, by indicating to your colleague from nuclear medicine or radiology that your intention is not to overtake his department, but to simply cooperate. That would really help. So let me finish with one more quote. This is from Gottlieb Daimler, and you all know that he wasn't really a medical expert, but he was definitely an expert on cars. And he said in the year 1890, the worldwide demand for automobiles will not exceed 1 million, only because of a lack of available chauffeurs. Now, that's another expert that proved to be wrong in the long run. But we have to really look that this does not become true for hybrid imaging, because it may become true for hybrid imaging if we don't provide enough chauffeurs. Or maybe even worse, others provide the chauffeurs. And that's not really our intention, neither on the nuclear medicine nor on the radiology side. So summing up, I think it's of all our interest to bring the two worlds of radiology and nuclear medicine together. And with that, I thank all my collaborators, and I thank you for your attention.
Professor Antoch, have the benefits of hybrid imaging become obvious?
They've become obvious over the past, let's say, 15 years now. Hybrid imaging has been available for, let's say, the last 15 years, and they've become extremely obvious in oncology, especially. That is the main indication for PET-CT scanners, and they've also become obvious for SPECT-CT, which is another modality, and there it's used both for oncology and for cardiologist indications. So these are the two main indications, and when you bring two modalities together, and that's radiology and functional imaging, both together, then you are able to optimize both, and you get additional benefit as compared to just looking separate at separate images.
What is the secret behind precise diagnostics?
The secret behind precise diagnostics is to not just rely on the imaging system, but to have the people behind the imaging system that are able to read the images correctly. And for hybrid imaging, it's extremely important to not only have one person that knows the morphological, the radiological part, and one knows the functional part, but you have to have people who know both sides of the hybrid imaging system, and then you are able to generate the correct diagnosis.
So looking at the competence issue, what are the current challenges in this field?
Well, there are in fact two challenges. One challenge is the problem that we don't have a combined training program yet. We have two different specialties. One is radiology, one is nuclear medicine, and we need a combined training program giving us the opportunity to generate specialists that are able to read both sides of the imaging procedure. We don't have that yet. And the second problem definitely is a turf battle problem. The question is, in terms of reimbursement, who gets, easily said, who gets the money for the imaging procedure? And we have to solve both problems. We need new training programs, and we need to solve the reimbursement problem, maybe linking the reimbursement to an imaging center rather than to a separate department. And if we are able to solve those two problems, we will have specialists available in a large number to read those data sets.
What is your personal message to the communities of radiology and nuclear medicine?
Well, my personal message, I believe, is very simple. Radiology and nuclear medicine have to overcome their political barriers and have to get together. That's a very simple message.